Kristi Kane here. Welcome to ElderCircle Forum. At ElderCircle, we link our aging community members to programs, volunteer opportunities, and services to keep them active, independent, and in their own homes longer. Today with me, I have Kelly Lawson, who is the Director of Emergency Services at Fairview Range Medical Center. Welcome, Kelly.
Good morning. Thank you for having me.
So, Kelly, you are a graduate student right now, getting your master's degree in nursing.
Correct. So I currently, as you had mentioned, direct emergency services at Fairview Range in the emergency department. I also have responsibility over urgent care, infusion services, as well as our respiratory department. So a full service line there at Fairview Range, and I'm currently going to college to obtain my master's degree as well. Excellent. And through that, we identify that there's a lot of opportunities for prevention. So thanks for having me today.
Good. Well, I'm excited. We're going to talk a little bit about wellness today, but first of all, tell me a little bit about yourself.
I am a long-term Itasca County resident. I graduated from Greenway in 1988, have stayed in the community and currently live in Taconite. I have been an employee at Fairview Range since 1998.
Wow.
Started as a graduate nurse and then went to ICU and then ended up in the emergency department, and I've also worked a couple years over at Grand Itasca in their emergency department as well.
Okay.
And about 2 years ago I took on more of a management role, so not so much at the bedside but kind of behind the scenes and giving nursing and patients the resources that they need to stay healthy and well.
Okay. Well, emergency services I think probably takes a special kind of person. Tell me what you love about that.
In the emergency department, you know, we see a wide range of ages from 0 to 100. You never know what's coming through the door. And it's all different diseases and illnesses as well as injuries. Okay. So it's very fast-paced. And in today's society, people are seeking out emergency care more than they ever have. Mm-hmm. So with that being said, we've just identified the fact that let's prevent them from coming into the emergency department. The costs are astronomical.
Yeah, absolutely.
And so what can we do to prevent them from coming in and giving them the resources and the education to help prevent emergency department visits?
And I think with what we're seeing with the general population and the big bubble of aging community members and the smaller number of caregivers coming up behind them, prevention is more important now than it ever has been in life as we know it in America.
Absolutely. I think our census has doubled over the last couple of years through the ED and the urgent care, and there are fewer primary care providers that are available. For people to access services. You know, they're waiting up to a week to see somebody when you wake up in the morning and you're not feeling well and you're like, oh, what am I going to do for the next week? So they're seeking emergency services as a result of our diminishing healthcare workers.
So tell me a little bit about Fairview Range, kind of the geographic area that you serve and what specialists are available there. And
of course, we're in St. Louis County, mm-hmm. so just the neighboring county there. We have emergency services and urgent care. We also have inpatient acute care. So we have a medical department, okay. Surgical. They also take care of pediatric patients. And then we have our intensive care unit. We have a 4-bed intensive care unit with specialty ICU nurses. We also have a women's health and birth unit. And then we have our behavioral health unit that currently has 19 beds with a plan of expanding. That is another area within our community for mental health wellness.
That is great news because we hear often that there's a shortage of mental health beds mm-hmm. in the area. So today we're going to talk a little bit about wellness, and I think influenza is one of the areas that you have kind of specialized in. Mm-hmm. Tell me a little bit about how our aging population can help protect themselves from the flu.
Well, the flu, it's estimated that it affects between 5 and 20% of the population. Okay. The one thing that people can do in the community, primarily our aging and seniors, is get their flu shot each year. I know that there's a lot of misconceptions on what the flu shot is and how it protects you, but it is identified that it is about 70% effective.
Okay.
So it is highly recommended that our 65 and older, as well as caregivers that take care of those age groups as well, they obtain their flu shot each year.
Really, most people.
Yes, most people. You know, and then you're really young, and then the pregnant. Those are kind of, and then anybody with a chronic illness. Okay. So I would say that's probably about 80% of the population that they're really pushing for it.
Sure.
And currently, we're only probably about 40% of people in our community that are obtaining the vaccine.
Really?
Yes.
I'm surprised.
Yes. So the CDC and the Minnesota Department of Health, as well as all the literature, identifies that's the #1 way that we can protect ourselves each season from influenza.
And there's a lot of places and outlets to get the flu shot. Let's just say it's not covered by your insurance or you don't have insurance. Where are some of the places you can seek out a flu shot?
Any of the local pharmacies, I know that they have them. Even at Walmart, you can go there and obtain them. The Minnesota Department of Health has different areas, so likely the Itasca County Resource Center, you can obtain a flu shot. And you know, I was thinking about it earlier, people are seeking medical care while they're sick, and then we have our healthy patients going into the clinics to obtain, so you're being exposed. So I think that's kind of a gap in healthcare, that it's like you're encouraging people to come into the clinic while they're sitting in the waiting room with people who are coughing and sneezing.
Oh, sure.
So just having that heightened awareness that if you are there ill, to wear a mask and make sure that you're covering your coughs and your sneezes, because that's the way of transmitting influenza.
Show us how you should cover your head.
Yes. So always cough and sneeze into the crook of your arm. And then making sure that you're washing your hands frequently, as well as obtaining, even if you have an alcohol-based gel, to sanitize your hands.
Okay. It's funny how, you know, that's covered in school when we're growing up, and if you're in healthcare, we're always doing in-services on how to sneeze, how to wash your hands.
Exactly.
But it is just a natural reaction to go,
yes. And that's what we used to do growing up.
Yeah.
You know, it's kind of changed since then, but we were always told cover your cough. Well, that's with your hand. And then if you're not washing those hands or sanitizing afterwards, and you even touch a door handle, the next person that comes along, it's a very virulent virus, influenza. So anytime you touch that door handle or any object after somebody has done that, you're at heightened risk of being exposed.
So very important. You talked a little bit about an alcohol-based gel for washing hands, but really if you don't have access to that?
Just soap and water.
Yep.
Just some nice warm water and some soap and just washing. And you know, they recommend singing the ABCs while you're doing it. So that identifies that it's been long enough that you've washed.
I've read that it's equally important to get your hands dry.
Yes.
Is that
that
correct?
Is true.
Okay.
Yep.
So making sure you also dry thoroughly.
Yes.
Okay. What about staying home?
It's very important. I know that with jobs and kids that are in school, it's difficult for people to take time off or have their children stay home from school. But with our aging population in the community, and we want them out and active, we don't want them to have to sit inside their home, even if it's, you know, a day that it's 20 above, to be able to get out. But they're at heightened risk of exposure if our healthy generation that is out and about are not home when they are ill. And primarily those children, they identify that you're typically most contagious about 24 hours after exposure, so you likely don't even have the symptoms. So that's when you're most contagious, and then when you have that high fever with influenza. And little children are able to expose and be more contagious for a full week.
Oh, wow.
So usually why we have the high fever as adults, we're considered contagious, but children, even after a fever has broke, they can pass it along for up to a week.
Okay. Okay. So one of the things that we talked about earlier is the importance of still staying active in the winter, physically active, so that you can combat a flu if you should, and come in contact with that virus. And part of that, I think, means fitness and exercise and wellness, which is a challenge for aging people when it's cold and snowy and icy, and really a challenge for all of us.
Absolutely.
And then another piece, I think, would probably be nutrition. Can you talk about those two areas? And
So one way, on top of getting our flu shot each year, is just identifying that if you come into contact with any type of a virus or infection, that the healthier you are, the more ability you have to fight off that illness. So eating a very well-balanced diet and your meals consisting of your vegetables as well as fruits, staying very well hydrated. I don't think that any of us drink nearly enough water. They're recommending up to 8 glasses a day and probably even more in the winter. So staying well hydrated, eating a balanced diet, and then just getting out whenever you can and staying physically and emotionally, socially engaged. That will also help with being able to fight off.
And just to clarify, coffee does not count as water. Correct?
It does not. And that's kind of a misconception. They'll say, oh, I had four cups of coffee this morning. That's actually kind of a diuretic, so it dehydrates you. Right. It's got the opposite effect, even though you pour in a whole canister of water into your coffee pot.
Right. So if you had 4 cups of water, you should now probably have
an
12
extra
cups of water, or 4 cups of coffee, 12 cups of water.
Exactly.
Instead of 8. Okay. Yeah. And do you have some recommendations for ways to stay fit and strong and healthy for our aging population during the winter months?
So in your home, even being in a chair, just grabbing some 2-pound weights and just lifting some weights, being in the chair, getting up and moving as much as you possibly can. You always want to be conscientious of the risk factors with falls, for rugs and whatnot, but just getting up and moving as much as you possibly can. I know that the local YMCA is an option. And utilizing the gym and walking or going to the mall. I see a lot of our senior elderly population going to the malls and just walking the hallways where it's a little bit safer rather than walking outside and being exposed to the cold. I
always tell people too, just get up and down out of your chair 10 times every few hours, or 5 times or whatever you're able to do, because once you lose that strength in your legs, it's hard to regain when you're
It is. So yes, just getting up out of the chair. And then I think too, just doing lots of deep breathing. A lot of times when we're sedentary and we're just kind of sitting, we don't expand our lung capacity. So that puts us at heightened risk for pneumonias and the ability for even a cold to kind of settle into our lungs. So just frequently taking big, deep breaths to expand the lungs.
That's good advice. I hadn't thought of that before. But yeah, absolutely. You mentioned fall risks when we were talking about fitness. Can you elaborate on that a little bit? I know that is a huge fear for a lot of our aging community members, and it should be, but there are simple ways to prevent it.
Yes, so of course in the winter seasons when it's slippery, just being aware of your environment. So where's my car parked? Has it snowed recently? Is there salt down? And then at any time, just making sure that you're using those assistive devices. So even if you don't use a cane or a walker in the summer months or when it's not slippery, just grabbing those and helping you out to your vehicle to help prevent a fall. With aging, we lose our ability to sustain and we don't have the reflexes that we used to. So even when you fall, you're going to maybe fall back and strike your head, or the blunt of the fall might be on the shoulder or the hip. And of course, with aging, we're at more risk of fractures due to osteoporosis. So just being just well informed of your environment and what resources you have to help you.
And I think not only just with aging, but just with being all bundled up for outside and wearing big boots and gloves and mittens, our dexterity isn't what it is.
Absolutely.
In the summer.
And that's another thing too, is just having non-skid shoes on.
Oh, sure.
And a lot of times people will have the shoe covers. That is helpful. But even when you go from outside to inside and you step on that tiled surface, it can be slippery. So making sure that you're aware of what type of shoes you have on to help with preventing falls.
So you were talking about the car and getting in and out safely, but what about just being prepared for winter transport? Having the right things packed in the car?
Absolutely.
Do you have some tips on that?
So of course we know when it's cold and and especially if it's been snowing or the weather is treacherous, making sure that we have a plan.
Okay.
Again, knowing what your surroundings are. Do I really need to go out today? Is this something that I can put off till tomorrow? Or do I have a family member that might be going to town in a couple of hours? Maybe I could just ride with them.
So all the things we preach to our young kids.
Exactly. Yeah, it kind of comes full circle.
Right.
Yes. And so just making sure that you do have warm clothing in your vehicle. Okay. Coats, hats, mittens. You know, they say just even a couple of minutes exposed skin to the cold, especially with wind chills, can cause hypothermia as well as frostbite. So knowing what those risks are, and then when you leave, make sure that you're calling a family member and letting them know, guess what, I'm just going to run up to the store. I'm probably going to be gone for a couple of hours. Just letting people know where you're going to be, right, so that they can check on you and say, you know, if you don't hear from me in 2 hours. So just having that plan for preparedness.
Absolutely. My mom is in her middle 70s, and she's very active and independent still. And as a result of being active and independent, she often takes long trips. She thinks nothing of hopping in the car and going 6 hours, and you know. And I'm thankful that she does that,
right?
Because frankly, she has more time right now than I do to come see me, and it's easier for her to get away. But what always ends up happening is she'll come for a weekend and then think, oh, I'd like to stay another 3-4 days and take in Dallas's game or something.
Right.
And then she can't because she doesn't have enough medication with. So I think that is another thing to be thinking about, is if you're going to go somewhere in the winter, you want to be prepared to have the right supplies with you to stay longer should the weather intervene.
Yes, that's an excellent point. So, you know, the recommendation is, you know, shelter in place is what we call it. So if we were to have some type of an event in our community, we really need to be prepared for about 3 days.
Okay.
So, you know, not waiting till Thursday or Friday to say, well, on Thursday I'm going to call to get my medications refilled, because what if you can't get in on Friday? Now you're going to go the weekend, or if there's a snowstorm or something that impairs you from obtaining your medications, now you're going to run out. And as we know, those are very important. So just having that heightened awareness and being prepared anytime we go on trips, as well as just being at home in the winter seasons.
I'm going to just veer a little bit from the topic, and you can redirect me if you need to, but I was thinking about medications, and I know that this is a topic with a lot of our aging community members, is the cost of medication and reimbursement and co-pays, and tell me a little bit about your opinion on utilizing online pharmacies or mail order medications, because I see a lot of seniors looking into that option.
I think it's an excellent resource for aging population. I think one of the setbacks is being able to access them online. So if you're not real familiar with a computer or how to obtain that website, but if you could reach out to a grandchild, I mean, they're amazing with electronics, and just helping somebody set you up with those resources, and then they can just be mail ordered, and then they, you know, are available, and they're very timely, and it's not dependent on you going and picking them up.
And you do find that to be a reliable?
It really is.
Okay.
I know that a lot of the local assisted living facilities will do that for their residents.
Okay.
And they come in the bubble pack, so they're all ready to go. You don't have to depend on somebody to set them up for you.
Oh, they're all pre-counted and pre-portioned. That's
exactly.
Nice.
It is.
Yeah, that gets to be, I think, one of the bigger areas of where it's easy to make a mistake, because a lot of times the pills look the same,
exactly,
or similar.
They do.
Yeah. Good. So, any other ideas or tips for us, Kelly, that I might be missing on how to stay well during the winter months?
You know, winter is a little bit more challenging. You know, we're lacking the sunshine, and so we don't feel as energetic as we do in the summertime. So just taking those vitamins and supplements as prescribed by your provider, making sure that you are always discussing those with your primary care provider. Staying active, as mentioned, trying to eat healthy. I know around the holidays it's difficult. It's not unusual to pack on a couple of extra pounds in the winter. That also helps with the heating and some when we're hibernating. But just being prepared and being aware of that.
Have you ever seen, or do you have any examples that you've witnessed of people who've gotten in trouble by not being prepared during the winter months?
Yes, it's not uncommon for people, you know, we want them to stay active and we encourage independence, but, you know, getting up on the ladder in the winter and trying to clean out those rain gutters or try to get the snow off of roofs. We've had several people presenting falling off ladders, sustaining significant injuries, head injuries, fractures of the hips. And that's a major setback for our aging population, going through that surgery and then going through all of the rehabilitation. And then you're at increased risk for all of those other infections such as pneumonia and bloodborne infections.
Okay.
So just any time that you're going to be active outside, knowing what your risks are, where are my resources, is this something that can be put off, can I delegate it to somebody else, can I pay somebody? Shoveling is another thing that we talk about. People, you know, oh, I'm just going to go out and just do my sidewalk while they slip and fall, or if it's real heavy snow and you're not aware of that, putting that extra strain on your heart. We have several people that present after shoveling with heart attacks.
Well, and I'll just pipe in and say we have resources for that at ElderCircle.
Perfect.
People that will help shovel and clean your roofs. And so if you choose to prepare, call ElderCircle, and if you don't, call Fairview. No, that's terrible. But yeah, there are lots of other resources out there as well that would help with those things, so it's a matter of reaching out and
exactly, because I feel like we always say try to stay active, and people are like, well, this is the way that I stay active. I want to keep my yard up, I want to stay on task with chores, and but doing that, you know, you set yourself kind of up for some dangerous situations with falls, as well as if you have a heart condition and shoveling.
I think people are programmed a certain way, and we live a certain way most of our lives, and it includes going to work, maintaining our home, doing our chores, and even trying to change that programming. For instance, every year I try to make exercising a priority. And some days I'm successful and some days I'm not, but usually it's never a priority. Work always wins over exercise or you know, responsibilities with the kids or home. And so it's the same when you're aging. You really have to change your priorities on how you manage your day, and it might mean lifting weights in your chair, or you know, doing some stretches versus cleaning your roof, or
and I just wanted to mention too with influenza, I think that there's a lot of misconception of what it truly is, just by the fact that we have several people that present to the emergency department or the urgent care, and they'll say, I believe I have the flu, and okay, what are your symptoms? Well, I've been vomiting and I've had a lot of diarrhea and some abdominal discomfort, and I think that there's just some confusion regarding what true influenza is. It is a respiratory illness. It's not typically involved with GI. So that's more of what we call the stomach flu or gastroenteritis. With influenza, even it's a lot different even with colds. You know, a cold is something that you kind of wake up in the morning, you're like, oh, I'm feeling a little stuffy, and you get a little bit of a headache, and you just feel a little bit run down. With influenza, you can wake up in the morning and feel just fine, and by 5 in the afternoon, people say, I feel like I've been hit by a truck. It's the severe body aches, the headache, the high fever. It can be associated with a cough and a sore throat. So usually when you have influenza, it's associated with that real high fever and the body aches. Those are kind of the telltale signs. And if you have those symptoms, there is treatment now. There is an antiviral called Tamiflu. It is recommended that anyone over 65 who believes that they do have influenza and they test positive, there are 3 strains of influenza. There's A, B, and C. C typically doesn't make you feel as ill as the other 2. But if you're feeling that, oh, I have this high fever and I believe I do have influenza, it's best to get in within the first 48 hours to be prescribed that Tamiflu, that antiviral. It won't cure it, but it will decrease the length of the influenza as well as the symptoms.
So don't wait for it to pass.
Exactly.
So do types A, B, and C all present the same symptoms?
A and B do. And C is a little bit different. C is more of kind of the cold. So if you have a cold versus influenza C, you might not know the difference. But the A and the B are what we want to treat the Tamiflu with.
And you talked about the stomach flu being a gastrointestinal. Is that truly a flu, or is that just something we've coined?
That's something we've kind of coined. Currently going through our community, we have a virus going through. It's called norovirus. So we've seen a lot of abdominal discomfort, vomiting, and diarrhea. So, you know, it's not anything that you should be passive with, because you're at increased risk for dehydration, especially if you can't keep any fluids down, if you're constantly just vomiting. So making sure that you seek medical attention if you're feeling that you're becoming more dehydrated. But again, with those viruses, the norovirus, it's highly contagious, and so you really want to be diligent with your hand washing, and as well as using the alcohol-based hand sanitizers to prevent the spread.
So I'm thinking about a lot of times I've seen in the community people that let this go too far, vomiting, diarrhea, and they become dehydrated, older population, but don't call 911 because they think I'm just going to rest and this will pass, and then get into real serious trouble because they didn't seek medical attention and become dehydrated and etc. So tell me a little bit, if you can, about calling 911 for this type of situation.
So if it's been going on for more than 2 days and you haven't been able to keep absolutely anything down and you're in the restroom frequently, you're really at high risk for dehydration. But with dehydration, we can also have imbalances of our electrolytes. So your potassium can become very low, as well as sodium levels. And then that puts you at higher risk of heart arrhythmias. So then that's when they get very dangerous. And you can go into what we call a shock state, because you don't have enough fluids in your body to, you know, for circulation. So just being really conscientious. So if you stand up and you start to feel like kind of your heartbeat in your head, or you feel that your heart starts racing, going from like a lying to a sitting or a standing position, or you get real dizzy or lightheaded, those are pretty good indications that you can kind of monitor that I might be getting a little dehydrated here. So the best recommendation too is if it's in the first 24 hours, you know, people think, oh, I need to take this big glass of water and gulp it because I need to stay hydrated. The best thing to do is to take frequent small amounts. So if you have an antiemetic or anti-nausea medication, taking that, and then just like every 20 minutes taking about a tablespoon of water, and that's all you need. About every 20 to 30 minutes is just taking a couple little sips, and then just gradually increasing as you tolerate it. So trying to rehydrate at home, trying to get to that place where you feel healthy again. Yes. And at any point that you feel that you're getting worse and not better, those are times that you need to seek medical attention. Calling 911 if you don't have transportation, or calling a family member or a loved one and just saying, you know what, I'm just not feeling well. I feel like I'm getting better as compared to yesterday or even the last few hours, and making sure that you get in to see somebody.
And just like it is when you have young kids that get sick, it seems like it always happens at 10 o'clock at night.
It does.
And so is that grounds to go to the emergency room, or, you know, would you advise people wait till morning?
And you know, if the onset is at 10 p.m., you probably can make it through the night, unless there's some other associated symptoms. Anytime that you're feeling dizzy, lightheaded, chest pain, shortness of breath, those are all classic telltale signs that you need to get in sooner than later. But if you just have a sudden onset of vomiting or loose stools at 10 p.m., you can probably try to make it through the night, doing the recommendation of just taking some few sips of water and staying hydrated, and in the morning just reassessing the situation.
Wonderful. So is there anything, any resources you'd like to leave with our viewers before we finish up today? Anything we didn't cover?
And I just kind of want to touch on antibiotics just a little bit, because it's kind of a misconception as well. Individuals will come into the emergency department and they'll say, oh, I was diagnosed with influenza. An antibiotic does not cure influenza or the common cold. Any of those viral illnesses, antibiotics are not effective for. So if you've waited too long and now your influenza has transitioned into a pneumonia or an ear infection or some type of respiratory or bronchitis, then you would be a candidate for antibiotics. So I just kind of wanted to get that out there, because a lot of people are a little disappointed when they go in and their healthcare worker says they don't get a shot of penicillin, and it's like, I'm not going to get any better if I don't get antibiotics. It's not effective. So they're really being conscientious of not giving antibiotics for every little ailment that people come in for. So kind of just touching on antibiotics. And as for resources, I know that, as you had mentioned, ElderCircle is a great resource for Itasca County. And so Just another one, I believe, is the Itasca County Human Services.
Yeah.
Contacting them for any questions. First call for help. Absolutely. At 211, asking any questions, and they will provide resources. If you are somebody that does a lot of research, the Minnesota Department of Health has great information online, and they will send you any information, educational materials, as well as the Center for Domestic Preparedness, so it's the CDC.
Okay.
They're a great resource, and they have many initiatives throughout the country for keeping people healthy and well, and it's People 2020. So we have a lot of goals throughout the healthcare system for prevention and trying to keep people healthy so that they're not accessing emergency departments.
Excellent. Well, thank you for all the great information today, and we wish you the best of luck with your schooling. It sounds like you have a busy schedule.
It's been busy, but I look forward to seeing great things come of it. So
excellent.
Thank you for this opportunity.
Yeah, thank you, and hopefully we can all have a healthier winter.